Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, in the secondary glaucomas, we also have one more type of secondary glaucoma, which is actually a traumatic glaucoma. Glaucoma can occur due to a blunt injury. So, blunt injury or traumatic glaucoma is also called as angle recession glaucoma, or it can also be inflammatory glaucoma also. Next, in the secondary glaucoma, whenever there is trauma in the eye, there can be intraocular hemorrhage. That is, there can be hemorrhage present in the eye. In the eye, because of the presence of hemorrhage, or in the hemorrhage, what do you see in the eye? There can be presence of RBC and macrophages, which will engulf the RBCs, may also be seen in the eye. So based on that, we have four types of glaucoma. One, we have red cell glaucoma. In red cell glaucoma occurs whenever there is intraocular hemorrhage. The deposition of red blood cells results in red blood cell glaucoma or red cell glaucoma. Then we have hemolytic glaucoma, which occurs due to the deposition of macrophages which are laden with RBCs. Macrophages which are laden with the RBCs, when these are seen in the uh, aqueous chamber or in the eye, then we call it as hemolytic glaucoma. Ghost cell glaucoma. Ghost cell glaucoma is mainly seen in the vitreous hemorrhage. We see ghost cell glaucoma. Then we have hemosiderin laden glaucoma. So actually these RBCs which are present, which are engulfed these macrophages which are engulfed the RBCs. These RBCs are phagocytosed into hemoglobin. Hemoglobin will produce the iron, okay, moiety, and the rest of the hemoglobin is phagocytosed. So this iron is deposited in the angles, resulting in hemosiderotic glaucoma. So these are the different types of traumatic glaucoma.
thank you and thank you for watching.